great pleasure to introduce to you Nate Osgood, who's pretty much an expert in a large number of fields and a real integrator of multiple systems and methods. And he's going to talk about big data integrating theory with models. Sorry, theory. Try that again. Big data, theory, and models. So, and this is really part of a 5-day workshop about this general topic. So, a few of you people just for this will hopefully find it stimulating.
So, thanks so much, Jeff, and it's a real honor to be able to deliver a public talk like this, which for those who have been with us for the past 2 days, you'll find this a distinctive but complementary set of topics that hopefully will inform some of the discussions going on this week. So as Jeff indicated, I'm going to be talking today about cross-leveraging 2 areas where there's lots of exciting work going on. In the one area, the use of system science methods in health, most notably the areas in which I concentrate on dynamic modeling for informing health decision making at multiple levels. And secondly, the emergence of big data sources in the health area through the use of ubiquitous sensing, social media platforms, environmental sensors, building instrumentation, a wide variety of other factors that lend insight into health behavior, health risks, and can really inform our theory building concerning human health behavior and outcomes. So within this this talk, I'm going to be starting with the discussion of some motivations for the use of dynamic models, but I'm going to keep my comments there extremely short because so many of you have seen me talk about this so recently. Secondly, I'll talk about the need for rich behavioral data within these models and introduce a system that we've built around Android smartphones, which is an epidemiological sensing platform that works together with some external sensors as well and can be cross-linked to a wide variety of other digital epidemiology data sources. I'll present a case for why the combination of these two confers particularly value, and why in many ways the sum of the two offer the two taken together, if you look at their value, it's more than what you'd expect through the sum of the value of the parts. If we have time, I'll talk about a couple of vignettes and some reasons to think that not only is the provision of epidemiological data in a digital form, the sort we talk about here, valuable in informing models that may be required in some cases for real accuracy with these models for certain types of questions. I'll talk a little bit about some open challenges and then we'll conclude with some high-level remarks. So the context of this work is the increasingly common use of rich decision-oriented simulation models within the health area. And that is closely related to the subject of this workshop, although the domain is rather. And the observation is that building, that working within the health space in particular confronts us with a lot of challenges associated with complex systems. These systems behave, they react to our interventions in ways that are hard to anticipate. When we try to set policies, sometimes they end up biting us back because we haven't considered a set of effects. And systems like this, which exhibit this sort of dynamic complexity, are best approached if we have some understanding of how the system works. Computational models, dynamic models, simulation models, provide us a way of characterizing how the system works that provides a potent thinking tool to think through possible consequences of our actions. The theories captured within those models operationalized in such a way we can run out a simulation model over time and ask what-if questions with it, are no better than our thinking, but capturing them in models allows us to collectively refine our understanding about how the system works and advance that thinking so that over time, in a more and more integrative fashion, we can account for a larger and larger set of reactions to our policies and plan our policies more judiciously and with greater precision. The issue that I'm going to be talking about today is that while computational models are increasingly articulated at a fine-grained level to address very detailed and very concrete policy problems, creating those models imposes a very substantial need for data. One might say an inordinate need, an inordinate appetite for data. And while these models help us understand the impacts of choices that we have at hand, frequently that data is not readily available through traditional survey instruments to ground them. So when we ask about the impact of housing relocation, for example, relocation of individuals from a poor neighborhood to a mixed income neighborhood, as is done through Section 10 housing vouchers in the States, for example, we know many of the outcomes, but we don't know why those outcomes are seen. Is it because of greater availability of grocery stores in the new neighborhood? Is it because of availability of amenities for physical recreation like ball courts and parks? Is it because the new neighborhoods offer greater safety and physical activity such as walking, which might otherwise be prohibitive in neighborhoods plagued by high crime? We don't know if it's because families who are taken out of their familiar environment and relocated end up spending more time together. And when we go to build computational models that characterize the impacts of housing interventions, these are questions that matter. And many people are asking these questions, but traditional survey instruments, self-reports on surveys, for example, find it hard to quantify even such simple things as physical activity levels, much less things like sedentary activity or family cohesion, etc. Within the context of domains such as these, we really have an important need for data, not only to help us calibrate models and parameterize them, for those who have some sense of what those mean now, but also to help us build the theory that's captured within those models. Now, this need for greater data cuts across the multiple modeling techniques we're talking about here. Stratified aggregate models, for example, our TB model stratified into 17 age categories, 2 sex categories that some of you would have seen flashed up yesterday. It really has a large amount of need for understanding of contact patterns, among other things. Individual-based models, the sort of agent-based models we've been talking about, have particularly strong need and particularly offer particularly great value in using this data. For example, capturing longitudinal effects on individuals over time and comparing them against longitudinal data produced by the simulation model. Inasmuch as we're building theory with these models, we're typically articulating our theories at a finer and finer level, and we find ourselves in a position where we need to posit how human behavior differs in response to location, for example, how physical activity levels change and interact with sedentary behavior, which is a rather distinctive concept, spatial proximity and ways in which it influences transmission of attitudes or norms, and the impact of social context on people's health behavior. Engagement in communication behavior and the ways in which that shapes people's belief. Now, absent understanding of this sort of behavior, the potential for these sort of models to quantitatively evaluate detailed policy trade-offs is really compromised. In some areas, we may still be able to build models that can yield tremendous insight, but for certain very important and pressing health policy questions, our opportunities are limited absent this sort of understanding. So within our group, we've been turning to a variety of data sources, most notably the use of smartphones to enhance data collection. And this work in this area is motivated by the fact that, for the same reasons that underlie the tremendous proliferation of smartphones across our societies. Smartphones are truly amazing devices, and they recommend themselves to people because of the huge variety of functionality of apps, for example, available. And many of you will have engaged and used your smartphones for the sort of activities talked about here. What's less widely recognized is that a key enabling technology for many of these apps is the provision of an increasingly rich battery of sensors aboard smartphones, which run the gamut from cameras and microphones, which are things you're used to thinking about, to things like accelerometers, MEMS, compasses, pressure sensors, temperature sensors, etc. So the very functionality we come to depend on with these smartphones and that recommend them to us is the same functionality that we can leverage at little or no cost to their original function to yield health insight. So these sensors can be repurposed to offer a very versatile and powerful data collection mechanism, a set of data collection mechanisms to inform our understanding of health behaviors, our models, and thereby our understanding of trade-offs between interventions. A parallel trend that's occurring is that we're increasingly enveloped in, and most of the times in our lives, a sort of wireless cacophony where we have signals ricocheting around us from a wide variety of different wireless protocols and wireless systems. So Wi-Fi, Bluetooth, GPS, GPRS. Some of these terms will be familiar to you, some perhaps less so. But increasingly, these sort of wireless protocols and wireless transports are being used to communicate data of a wide variety of sorts, sometimes actively and sometimes with passive detection, such as RFID. These signals can also be repurposed at virtually no cost to provide other information. For example, give cues as to whether we're indoors or outdoors, locate ourselves within a building with a high degree of precision, capture inter-individual proximity, the distance between people, and to broadly disambiguate contexts. So with that little bit of an introduction for motivation, I'm going to be talking about a system, our second generation system, for wireless data collection. We had a first generation system about 4 years ago. We used it to capture contact patterns during the flu pandemic and cross-link that data to individual level health behavior data, which provided quite a bit of insight, and we used it together with some models and publications that you'll find online. Our Generation 2 sensing platform has leveraged the sharp rise of Google Android smartphones. We have a Google Android 4 app. We've used it in previous versions by custom rolling a version of Android, which allows us to deal with some earlier issues with earlier Android versions. The fact that this runs on commodity hardware allows us to ride the price curve down over time. So we can use commodity devices which confer great value to people to bring them along, which provides enormous incentives for people to keep the phone with them and keep the phone charged. Very, very important incentives. In this case, the app runs with episodic data collection. So periodically, to conserve power, it sort of shuts itself down for a couple minutes. Then it wakes up and samples from a battery of sensors as required and as with a level of frequency that's dictated on a per study basis and can even be varied during studies. And diverse sensor modalities, data from diverse sensor modalities accompanies data from context-triggered surveys. So we can have context-sensitive surveys that are triggered only in certain situations upon the phone for answering by the respondents. We've put a lot of effort into keeping the sort of data collected with this device secure and de-identified, and I'll be talking about that later. And the simplest option is a button that snoozes data collection. And then we have an opportunistic data backhaul that brings the data from this phone, such as might be carried here, back to our servers. And by opportunistic, I mean it operates when it's possible, and when it's not possible to upload data, it simply batches it up on the phone. The data on this phone accumulates at approximately 1 to 2 million records per person per month for common rates of sampling that we use, which vary between sampling every minute or so up to sampling every 10 minutes. And when we bring this back, we then centralize it within larger scale databases, and we can use it for a variety of purposes, including using it with various types of simulation modeling methods, which I hope to get a chance to talk about the marriage between them in a few minutes. To give you some sense of the sort of data we can collect with this phone, we collect data on a variety of measurands, each of which will shed light often on one or more sets of relevant information for understanding health behavior. So GPS, for example, we'll use to understand people's outdoor locations, for sure. To give some cues as to whether someone's indoor or outdoor, because GPS tends to be less effective in other cases. And we can actually cross-link that data with Wi-Fi data, for example, to classify their movement across a bunch of different spaces. In the case of Bluetooth, we can use that to localize people's position with a high degree of accuracy because of the short ranges involved, but also to capture proximity between individuals and certain non-participants as well. So between participants and some non-participants, those carrying discoverable Bluetooth devices. So, for example, we can map out Bluetooth contacts by hour of the day, contact duration in minutes, particular contacts between individuals, and we can capture proximity of those contacts. Here we're looking at sort of participant contacts for a very small initial study that we did with something on the order of 30 participants, maybe it was 40. Contacts with other mobile devices over a 1-week period, or Bluetooth devices over the entire study. What this is showing, is that most of these external devices they saw, which might have been one person efficacy downtown, probably someone else saw them as well. Hence they're located more towards the center. In these red ones around here are the various participants. So we are observing sort of the locations of various other participants. Wi-Fi and Bluetooth serve as location markers. And even in our rather small town, we end up seeing a very large number of beacons, as it were, that can serve as markers of location. For example, in a 1-month study, about 40 participants saw 19,000 different Wi-Fi routers and 9,700 different distinct Bluetooth devices. And we've done quite a bit of work with Bayesian location deduction. Compasses can give understanding as to people's orientation, as well as give some clues as to whether one's in a vehicle through detecting the engine block. For case of Wi-Fi, we can use it to recognize cases where we're changing location indoors, which is very powerful. For example, this movement among Wi-Fi delineated spaces. In this case, these are various spaces around town and indeed among different cities within Canada where participants roamed. And by distinguishing particular Wi-Fi routers, we can have a pretty detailed understanding of where people are, even absent GPS information. Accelerometers can give insights into physical activity patterns over time, but also to whether the phone is even being carried or whether it's simply sitting on a desk, for example. It can also be used to give understanding as to some other aspects of context. Battery, we make use of regular sampling and whether it's plugged in or not, which gives a sense, for example, as to use of the phone or whether we're indoors or outdoors. And finally, there's a set of surveys which can be time and context specific. They can be conditional on context, and they can involve a set of rather sophisticated constructs in terms of looping and conditional questions. We have a set of federated systems that work together with our IEPI system, our IEPI app. And they include a weight scale. So we use the Wii balance boards, which can be used to assess balance as well, to recognize people's weights. And they actually have to check their phone to see the recorded weight. This gives us quite detailed weight trajectories for participants over time. We further have a photo food diary, which leverages the cameras of the smartphone. We ask people to take pictures of their food on a periodic basis, typically not every meal. And this gives some sense as to what a person is eating. We actually have a dietitian that we're going to be working with in a coming study on gestational diabetes, who's going to be trying to make sense of some of these pictures. But more at an easier to use level, it gives a sense of where, when, and with whom people are eating, because we know something about the cross-link social context from Bluetooth. We know from GPS or Wi-Fi where they're located, and we know from the clock when they're eating. This can be quite helpful, and we've linked this with food-related questions that ask, for example, inquire about people's beliefs with respect to the food they're eating. The system is further coupled with a quite sophisticated indoor positioning system through colleagues in geography. Scott Bell, who co-directs the social science research lab there. And we further coupled that at times with TCP/IP communication monitoring, so we can capture communicational behaviors undertaken with the phone. Finally, we have a configuration updater, which basically allows us to download new surveys over time, if required, change sampling rates, etc., on the phone in the course of a study. So there's a push-pull sort of relationship. We have a variety of extensions that are currently under development and planned, which include sensing, for example, proximity to on-devices like TV. TV screen time is a big interest to some of our collaborators. Detecting hand-washing behavior, with particularly in the context of nosocomial infection transmission, calling behavior, etc. So there's a wide variety of things that we have going on over the next few months. Skipping forward just a little bit here, I should note that the surveys provide a particularly rich source of complementary data for the sensor data collected, and allow us to kind of disambiguate some of what we pick up with sensors. For example, someone's surrounded by, in a clearly high-density social context, we can ask questions about their relationships to the people around them. If people leave their house in the morning, we can inquire something about their intentions behind that. Or if they're engaged in high levels of physical activity, we can ask what's the purpose of that activity. Is it for utilitarian reasons to get from A to B, for example? Is it because of health concerns? Is it for recreation? Is there some other obligation behind it, etc.? This sort of information can provide substantive insight into health behavior and the underlying motivations for the measurands that we can receive. So it's very, very important in our context. And we've made very good use of it and secured actually some very interesting insight from previous studies where we've used it, particularly for physical activity. Now, each of the measurands collected on these devices is of interest and can shed very interesting insights into particular aspects of human behavior. But I would argue that the greatest insight comes from cross-linking these things. And there's kind of a Metcalf's law that applies here. I don't know, how many people here have heard of Metcalf's law? Probably a few people from IT background. So Metcalf's law basically posits that the value of a network goes up roughly the square of the number of nodes in the network. It was coined by Robert Metcalf, who was the inventor of Ethernet. And he coined this back in the late 70s or early 80s. The observation is that for each new person joining the network, they are conferred value through that joining of the network at a level proportional to all the other people already in the network. So the first person who joins the network doesn't really get much value from the network per se. It's like a one-stop subway system. But once you start getting two people, well, that new person joining gets value because they can communicate with the other person. If you already have 1,000 people on the network and you join, you're conferred even more value because now you have all these other people that you can communicate with. That's sort of the idea behind it. And I'd argue that a similar scaling applies at least in the cross-linking area. For example, we can cross-link a wide variety of these sensor types for particular studies. And indeed, we have studies running with a wide variety of partners internationally, which leverage different subsets of the sensors for providing insight into everything from flu sequestration, such as with our Michigan partners, to our partnership with New York City, looking at the issue of housing impacts to aspects of rural health. And each of these makes use of somewhat different sensor modalities and somewhat different sampling rates, but the real power comes from that cross-linking. So we can, for example, cross-link physical activity level with GPS location, thereby get some mapping of activity levels over the course, over the extent of our city. This is for a short and smaller study we did in Saskatoon. Or we can look at contact durations between study participants, how that's mapped out over space. We can map out the degree to which contacts between participants and participant, non-participant contacts, where do those take place over a wide variety of spaces. And the power grows yet further when one adds additional sensors. Some of those sensors that I've mentioned we can collect, like weight scales for sure, but others that are widely available. And this gets into the whole the rise of big data more generally. Social network information, for example, through Twitter feeds, blog posts, etc. Environmental sensing systems, such as provided by Geosense within the Canadian context, that pick up nitrogen oxides, for example, particulates, and report it for different regions. Water quality databases, increasingly available. GIS databases, which provide an understanding of the services located within a person who's located, a nearby person who's located at a certain spot. The availability of parks, walkability indices, etc. There are services that will map Wi-Fi locations to GPS, such as Skyhook, and there's an open source variant of that. Incident communications, so for example, reporting crime incidents, weather reports, etc. Huge variety of data sources that are available online, and I would note that some of them in the health area offer particularly great value. So for example, administrative data from our provincial or your statewide databases concerning people's encounters with the healthcare system, and understanding those in light of observed health behavior can be quite insightful. So we, for example, use GIS data. This is very, very simple sort of proof of concept to map for different participants who live in different areas of the city to what degree their daily activity spaces, they're going back and forth between home and work, for example, brings them in contact with different types of services or different types of stores or retail outlets. A primary constraint within this work, as you might appreciate, is security and confidentiality. We engaged from before we developed any systems with our ethics board from the get-go, heard their constraints, ended up ruling out certain types of data collection that were in theory possible for reasons of confidentiality. And we provided a battery of sort of characteristics that help enhance the security and confidentiality of the data collection. The first is a snooze option, so people at any time with very simple operation can disable data collection for the phone. We have strong on-device encryption provided, secure transmission in an encrypted fashion of the data. We censor, particularly potentially identifying Bluetooth information. And we further provide optional restrictions on a per-survey basis for on what pool of types of contacts do we collect information. Sometimes we disable phone data collection outside of a given area. For example, when someone leaves the area of a study, say a care home, and nurses go home for the day, we'll stop data collection so they don't have to worry about data collected from their external lives. And we have a quite detailed informed consent process. A sobering fact is a lot of this data is being collected by commercial companies without informed consent and with minimal understanding by the participants. We've done due diligence on that front. A second constraint, secondary but quite key, is the issue of energy economy. The primary constraint for our ability to collect information is twofold. One is compliance by partners in dealing with security, and confidentiality is an important part of that. And the second is this issue of energy capacity of the phones. The limited capacity of smartphone batteries means that if we really hammer the phone in terms of data collection, we're likely to exhaust the battery in the course of the day and make the phone an albatross, paperweight that maybe never gets carried. So we really try to minimize the footprint we place on battery life of the phones. It runs all in the background unless they choose to switch to it, say to disable data collection. And we've tried to optimize things on the data collection front and the underlying mechanisms so that we can keep the phone alive for long periods of time. So there's power analysis and optimization, judicious choice of sampling rates, and tracking of battery lifetimes. Fortunately, we're riding a very positive trend in this area. how many of people in the room have heard of Moore's law before? Okay, so that's a large fraction of people. It states that the processing power or number of transistors on a chip originally associated with computer chips approximately doubles every 18 months. And in recent years, that hasn't translated directly into greater performance in terms of raw speed of the computers in terms of visible operations because of barriers associated with some of the quantum physics involved in lithography, as well as some of the other engineering constraints. Fortunately, there is something, there's sort of a parallel law called Kumi's law, and it posits exponential advances in power efficiency associated with electronics. And fortunately, we're still rising in a log linear fashion, in an exponential fashion over time, in terms of energy efficiency of devices. So each new generation of smartphones that comes out has improved accuracy or improved energy efficiency compared to earlier ones. So some of you in the audience who have been seeing me talk about models may be asking, what does any of this have to do with modeling? I gave some early comments, but that thread may have been lost to you. Well, it turns out this sort of sensor data and dynamic models are highly complementary. And the benefits go both ways. Sensors, as I suggested early on, can greatly inform and ground modeling. They can help make sure we're not fooling ourselves with modeling. We're not just spinning our wheels in a speculative fashion. By helping to provide us rich sets of data to use to inform our models, both in a static sense, such as arriving at parameter values or arriving at theory captured in model structure, but also in a dynamic sense, using mechanisms such as the Kalman-Folter or sequential Monte Carlo methods, which help provide observations, say, of blood glucose levels over time, that ground our predictive models and bring them back in check with actual observations, taking into account error sources on both sides. Conversely, so sensors can inform and ground modeling in a bunch of different ways. They can help our models be more accurate and thereby inform with greater reliability our choices. On the other hand, modeling can help us make sense of sensor data. This sort of sensor data is nothing but large, huge volumes of numbers without models to make sense of it. We make use in our group of a wide variety of modeling types, machine learning and statistical models, everything up to very, very sophisticated agent-based models. And this sort of modeling helps add value to the sensor data, and in the first place, it helps it be used in the first place. In this case, modeling can help that data be positioned to help inform proximal and distal decision outcomes. So we can relate it, we can make sense of it in a way that we can use it to inform our decisions. So what are some of these limitations of sensor data? Well, we get gobs of it. And again, 1 to 2 million records per person per month is very common for our studies. And taken in its own right, it has limited generalizability. We don't know how to go from the particular observations of these participants to more general insights concerning health behavior of individuals more broadly. It has, in and of itself, unclear implications for decision making. Noise and missing data obscure interpretation. We have lots of missing data we need to work with. It's unclear what happens between sensor measurements. We're not collecting data truly continuously, and there's often gaps of multiple minutes when the phone is conserving its power. And we need to reason about what's going on during those times. But perhaps even more at a fundamental level, the sort of data that we collect, point observations. Oh, I see phone number, a long hex string, which happens to be Jeff's phone right now. And, oh, I just saw Andre's phone. I just saw this Wi-Fi router with this strength. Those observations by themselves don't really confer a lot of insight. Instead, we need to turn them into something we care about, some sense of, okay, I'm proximate to Jeff. I'm this sort of level of distance to Jeff right now. And we end up making inferences concerning the durations of contact, etc., from this. we might turn these measurements into an estimate. Okay, this phone is probably not being carried right now. It's probably sitting on a desk, because we can look at its orientation and we can look at its accelerometer values. So models are very, very helpful for helping to fill in the gaps here and link that sort of data to real decision making. But these models themselves have limitations. I referred to their gluttonous appetite for data early on, particularly more detailed models. And they have a certain fragility to assumptions. They have a certain brittleness to them if our assumptions are not really grounded. So we have dependence on certain assumptions regarding exogenous factors. We abstract over details concerning factors that we don't have data on. We put in assumptions about microbehavior, things that end up affecting individual choices. We know there's sometimes systematic errors in these models, things that will throw them off over time. Even the best, most precise model now will inevitably diverge from the situation going forward. And one of the biggest risks here is that we'll have overconfidence. We'll have overconfidence in sort of what we anticipate from the model. So I would argue there's a natural synergy here. The sort of data that we can collect from smartphones and by cross-linking to external data sources that are increasingly available in electronic form provides a rich grounding in observation. It provides rich databases for model parameterization and calibration, and dynamic calibration. I'll refer to this kind of filtering, such as the Kalman filter does, that brings the model back into alignment, and it's done at an even more powerful level with Monte Carlo, Markov chain Monte Carlo, and sequential Monte Carlo methods. And further, this sort of information can stimulate dynamic hypotheses. They can stimulate an understanding of what's going on, or cross-check hypotheses for interpretation that might go into the model. Dynamic models can help make census data, fill the gaps between measurements, help us filter out noisy sensor data. Our GPS sensors for participants, predominantly in Canada, have an unseemly predilection to place people in the southern Atlantic. Perhaps once a day, someone will appear in the southern Atlantic within our study population for 1 or 2 cycles, and then they'll be back to terra firma. These sort of models can also help us understand the implications of this observed behavior for things we care about, and can help us generalize it. This is very important. We have this very detailed sampling of individual behavior, and we'd like to turn that into something that's generalizable. For example, going from mobility traces of individuals over time to going to a general mobility model that kind of captures the essentials of how people move around our town, for example. So we've leveraged a wide variety of types of models for this. At the lower level, they include signal processing and machine learning models, things like hidden Markov models, for example, naive Bayes models, which help us collect the dots, help us classify whether the phone is on person or off person. Should we just ignore a lot of the data on proximity because it's for a phone that's sitting unattended? Is the person indoors or outdoor? Are they sitting or standing? Of great interest in the sedentary behavior. Are they using vehicular or non-vehicular transportation? For example, are they undergoing lots of vigorous physical activity, perhaps doing jumping jacks or moving around, or are they simply in a car on a washboard grid road in a rural area where the car is bumping up and down really fast? It can look quite similar in terms of the accelerometry, but by capturing the inputs from these other sensors and having multivariate models, we can actually pick up a lot of insight. Inference models, so we work a lot with Bayes nets, but also their elaborations of them using Markov chain Monte Carlo techniques for doing reliable inferencing, say, of chains of transmission, or to identify individuals who are likely infected but not known as such, etc. And finally, dynamic models of the sort we've been talking about that provide generative explanations that help us kind of understand why we see this behavior and provide a generalization of this. So just to give a little bit of sense of some of the work we're doing. We're looking at housing interventions with the City of New York, with their housing department, trying to understand the strength of various pathways. I had mentioned some of the influences, the various hypotheses people have advanced for why housing relocation seems to help, for example, lower obesity rates and increase high school graduation in teenage girls, but actually has slight adverse effects on teenage boys and in terms of incarceration or arrest rates. And this sort of study can help us check the consistency of various hypotheses that help explain it, going from family cohesion to issues of resource use within the neighborhood. So here we're capturing a variety of factors that shed light on these hypotheses. And we're going to be asking a variety of research questions. A second example is working with a long-term care facility within our town. This is jointly with our health region, to help understand the spread of nosocomial infection. Within a long-term care facility, we're distributing phones to all the care staff, the RNs, the LPNs, and the care aides, as well as to willing residents. And we can capture person-person contact as well as person-surface contact. And the models here include inference models as well as simulation models, and some mobility and discrete event modeling for capturing aspects of efficiency of organization. A third study that we're doing that's underway right now with around 100 participants is at University of Michigan, and we're looking at sequestration, its impact on flu transmission. So the degree to which having people self-isolate following discovery of flu symptoms ends up blunting the spread of infection within the social networks. And this involves very, very detailed and amazingly rich study design led by Allison Aiello and Eric Volz at Michigan, which involves delivery of food and class notes to symptomatic students, for example, and in keeping track of the proximity between the various students. So how do these sort of data from these sort of things work together with models? Well, we've tried various strategies. We've parameterized models to data. For example, we've simply driven contact patterns in some models using the empirical data we've collected during the pandemic flu season and simulated spread of infection using that. We've used mobility patterns to drive agent behaviors within the models. In other cases, we've sought to calibrate models to data. So here we have some generative models that we've created in a simulation fashion, and we try to compare the statistics generated from those models, for example, for mobility behavior, and see how consistent they are with empirical mobility patterns. We've looked at a variety of Bayesian inferencing approaches, and we further trained models on the data, for example, using classification schemes. Finally, we've used data as ground truth to evaluate the reliability of inference algorithms so as to understand to what degree those inference algorithms are likely to be reliable when applied in the real world. So I'm talking now about open challenges, and I wanted to provide a little bit of a provocative sort of glimpse of some work we've done here that suggests the sort of data we're collecting here may in some cases be really very important for making reliable decisions. This sort of sensor data can be increasingly easily gathered. We're not the only group in the world with a system such as this, although I think ours is beyond any of the other systems in terms of sophistication and its particular focus on health. But this data, while it can be readily cross-linked to other data sets and can inform these models, we had a question of to what degree does this really matter? To what degree does our ability to collect data on people's contact patterns every few minutes really inform an understanding of intervention outcomes, or in terms of the transmission of infection? Is it possible that novel data sources, for example, do not confer significant benefits to model accuracy? Is it possible it's a luxury, but not really something that's required? So we performed a variety of data knockout experiments. So in other words, we took this high-resolution empirical data, we coupled it with a quite detailed transmission model, of the sort you folks will have seen. It was an agent-based model in any logic. And we then simulated the consistency between running it on all the data, the full set of data to which we had recourse, and subsets of the data which we pared down. We essentially knocked out large fractions of the data. We resampled it at a much lower rate. So for example, sampling just once a day. If we sample just once a day, would our predictions of what we expect using the simulation model differ from our predictions of what we'd expect if we sample every 5 minutes or every 3 hours, etc.? In this case, what we were doing is we had some underlying social network, which was quite articulated, and we ended up comparing the results of various types of fitting of that social network as well as using the empirical data, the baseline data. So for each experiment, we ran an ensemble of simulations. I think it was on the order of at least hundreds of simulations of realizations for a given set of for a given scenario, and then we compared the results against the highest resolution case. So when we did this, we had this quite detailed transmission model, and we had this FluNet data set, which gave us this contact history, which would sometimes be downsampled. So one way of doing this is to simply construct a static network where each individual is connected to another by weights of connections proportional to the amount of time they spend together, say. We also looked at, for example, parametrically matching the structure of the network over time. And trying to use it to set up a sort of a network that was more expressed at a less detailed level. So we did a set of experiments, and the two sort of baselines or extremes are a fully detailed simulation where we had a certain number of endogenous infections expected on the one hand, and a fully aggregated one, which would approximately double the number of infections. So in short, just relying on a static network, a network where each connection between two individuals was weighted proportional to the amount of time they spent together, approximately doubled the number of infections we would expect compared to the fully detailed case using data from every 5 minutes. We looked at the option of sort of, if we had only collected data over 1 day and used that as sort of our gold standard, how much would that have distorted things? And it turns out there's huge variability day to day. And so it just as it's a fool's errand to try to find a typical person in the population, it can be a fool's errand to try to find a typical day. And the sad thing is that a lot of other researchers applying these sort of technologies are doing exactly that. They're assuming that a given day is typical. We also looked at the results for a wide variety of types of fitted networks, and we found various levels of distortion associated with them. These are for various sort of specific days. We had a weekend day and a weekday. So the implication here is that the network dynamics do change the simulation outcomes from close static approximations by integer factors. In other words, these network dynamics really do make a difference in terms of the number of endogenous infections that occur by several times. And it does seem that we need to collect this data over a longer period of time. In the second study here, we looked at another empirical question using a similar sort of knockout approach. And what we found is a real variation depending on how frequently we sampled. Sampling every 5 minutes, we'd anticipate this number of infections over time. Sampling every 3 hours, we'd expect this smaller number. And you can see it really is quite different in terms of the profile over time. So this sort of a very detailed sampling that we're doing on these phones, capturing even very brief contact durations, say between a person and others as they walk through a bus station, where there's large numbers of people in close proximity, but they're only there for a short period of time. We can miss out on those things when we're just doing occasional sampling. And we examined the robustness of this over a wide variety of parameter values that represent wide varieties of airborne infections. So salient points here. The model representation of contact dynamics can lead to significant differences in model results. the temporal fidelity with which we collect that can have a big impact, as can the sort of level of accuracy of network representation. And the sampling frequency required to represent condition accuracy varies with the time constants with which the infection spreads. So just some closing remarks on challenges. Some of our biggest challenges are maintaining compliance with study and buy-in on the part of participants, maintaining the participants in a state that they're actively bringing around the phone, for example, and providing really good phones helps a lot with this. Extracting high-level classifications is an area of ongoing work, for example, classifying someone's context, and creating generative models that explain this data is a really, really large point of emphasis. So abstracting patterns away from this data so that we can go from the specific observation, say, to a mobility model, or a joint mobility physical activity model that takes into account not only individuals in isolation of their behavior, but the correlations between the behaviors of multiple individuals, which is so dramatic a component of this. And a major challenge here is just addressing human factors: trust, interest, willingness to share information, safety of carrying the smartphone, etc. So just a few conclusions. Sensors of this sort are increasingly ubiquitous. This is just an early component of a giant wave that's going to be affecting us of digital epidemiology and big data informing many areas of human activity. These sort of commodity devices can serve a really powerful way as versatile sensor platforms, and diverse communication signals also allow us to establish context in a very effective way. Coupled with models, these sort of sensor data, models of a variety of sorts, these sort of sensor data can offer significant and complementary health insights. And really multiple types of modeling types are used to really best leverage this data. There's significant open questions on how best to leverage this data in dynamic modeling. We're again at the beginning of sort of thinking about this. And collection and model-based leverage of big data is not restricted to big players and doesn't require big budgets. Some of my colleagues that I work with are very much advocates of the idea that modeling should be done in the same way big science is done. Just as not every researcher who's interested in astronomy builds their own Hubble Space Telescope, there should be a concentration of modeling effort among those who have access to the requisite data, say large-scale administrative data in government statistics agencies worldwide. I would argue that the prevailing trends actually support a decentralization of modeling effort, and some of the sorts of data we can collect in this sort of low-cost, easy-to-deploy fashion can really open up research opportunities for researchers worldwide who are interested and willing to take the time to kind of learn how to make use of this sort of novel data sources. Finally, I'd like to offer my sincere thanks to those who have contributed to this work, including a variety of collaborators, Kevin Stanley most critically, who co-leads this work with me, a variety of students, and our funders in the form of NSERC in Canada, our National Science and Engineering Research Council. So those are all the comments I prepared. I'd be glad to answer questions as time allows. Thanks very much. So questions? Yes.
I guess the thing I was worried about, I think it's valuable work you're doing. But what I was worried about in the vouchers is that you imply that the people have security, which just isn't true. That it'd be relatively easy to isolate individuals from the data set using other data sets.
Right.
The other thing that kind of worries about this is that these things are useful, the trade-off must be seen.
Yes.
There are disadvantages to this data as well as advantages.
Yes.
And all I really want to comment on is that we need to be very wary of the fact that we are actually creating disadvantages as well as advantages.
I think those are very, very important points, and I think they're. I'd like to thank you for bringing them forward. The latter point I'll touch on because we do work with some vulnerable populations, and particularly there's a real risk, for example, that we will be engaged in very non-representative sampling. For example, it was noted that when we're working with lower SES populations, lower socioeconomic status, first of all, those who are most in a vulnerable position may not have the luxury of even coming in contact with the study, and if they do, they're some of the ones who are least likely to be able to keep a phone charged, for example, or maintain sufficient stability within their lives to allow them to reliably take it with them. They may be in positions where it's dangerous to be carrying around a phone in terms of gang violence or something. And so we have a very real risk that the phone itself may adversely impact things, which has ethical implications, and that we won't be sampling. And when we look at all this data, we may take it as representative in a way that it truly isn't. And I think this is a very notable thing, and people are just starting to think about some of these issues. They've come up in some of our informal discussions when talking about survey designs and so on. And I think there needs to be a lot more discussion. We're having a conference, incidentally, on this very issue of this novel sorts of data sources, where I'm hoping that this will be one of the real topics. The other issue you've mentioned, privacy and confidentiality, is something that we realized from day one in our engagement with our ethics boards about 4 years ago. The reality of the situation is that even if we go through all the due diligence in stripping away obviously identifying information, if we're capturing GPS traces of people's location and we're seeing their patterns day in, day out, morning, evening, etc., we're going to know basically where they live by examining that. And we've approached this issue in a variety of ways. In some studies, we simply omit that data because it confers marginal added benefit to the insight, and that's an important option. And this has been, through discussions with the ethics board. In other cases, we've thought about scrambling that in some sort of regular way, so you could capture proximity sort of in neighborhoods, but you wouldn't know which neighborhood it is. The problem is that in some places where we locate, there's such large, pronounced geographic features, it's hard to scramble that in that sort of way. But Barbara Entwistle at UNC, University of North Carolina, Chapel Hill, has some really interesting work where she's done some scrambling of social network analysis data mapped geographically. And there's some things to learn there. But we're very aware of this. We go through, very, very careful de-identification as far as names, but we are aware of this vulnerability. And it's also been a real point of difficulty for us because there's other people releasing these data sets publicly, and we're not at a point where we feel comfortable with that for these reasons. We just feel there's too much risk of abuse. The sad truth of the situation, though, folks, is that this data that I'm talking with you about today is unfortunately that sort of data is being collected by large numbers of commercial entities, unbeknownst to you through your smartphone. I mean, there's iPhones when it comes to iPhones, when it comes to use of some Google Android phones. There can be significant use of your GPS data, for example. The fact that you're going and downloading Google Maps while you're traveling around and so on gives a lot of information about where you're traveling. And Apple is sure to be mining lots of the data concerning people's sort of movement patterns using iPhone data. And there's going to be a huge rise in commercial use of this information. I feel great wariness about that. And one thing that makes me a little bit more comfortable is we go through the informed consent process. And that's much more than any of the other partners that are online end up doing. So, but I think the standards here need to be put into place quite quickly because there's going to be an explosion of use of data like this.
It should lead to actually commercial governments as well.
Governments,
because the security agencies and the police are using this data a great deal for targeting.
Okay. Yeah, that's something we in Canada forget a little bit. But one of the things that's come to our attention is there's a thing called the Patriot Act in the U.S. that allows for seizing data for national security purposes, which are interpreted very broadly, particularly under certain administrations. And that too, I think, is a risk. So I appreciate the comments. Yes.
Sorry. I think that followed on actually from the previous point concerns getting buy-in from people about what data they're getting and how to use. The point you made about
wonderful comments and something I should have emphasized. This is one of the big strategic directions, and I think it may have been indicated in passing in one of my slides. But this whole view of sort of dignity of risk and wanting to provide value to those who are offering up their data in this fashion, and we see it as potentially very important actually for informing health behavior. For example, we have a study that's just now gearing up. It'll probably run this summer with pregnant women with gestational diabetes and looking at outcomes. So we can pick up a variety of factors that are very hard to measure, like levels of sedentary behavior, day-to-day or within-day physical activity, eating habits. And these are very important for maternal and child outcomes. And one of the parts of this is going to be feeding back to the mothers information on their level of glycemic control, for example, their level of blood glucose control over time. And more broadly, we're very interested in providing back feedback on people's physical activity levels, level of sedentary behavior. How does this compare? And it comes into the area of persuasive technology. So one of my colleagues, Regan Mandrick, is an expert in that, of sort of how do you use technologies to nudge people in healthier ways. So I think there's a lot of potential here, and it can have an empowering impact.
Actually, you've answered part of my question already, because I'm interested in learning more about the spatial diabetes and photo diary work that you're actually doing.
Right.
Specifically GPS information that you alluded to.
Right.
Could you tell us a bit more about that and also the social things you're looking at?
Sure. Yeah, we're particularly interested in looking at so without going into this in too much detail, we've been working in the area of gestational diabetes for many years, and one of my collaborators has done quite large-scale studies looking at, for half the babies born in our health region in an entire year, looking at risk factors associated with a variety of covariates for maternal and baby outcomes. And one of the things we found is that there's certain strong effects that are hard to explain from traditional data, and it's our suspicion that that some of the outcomes could be better explained if we were to look at things that are difficult to measure, things like sedentary behavior and physical activity levels and eating habits, because some of the adverse outcomes in terms of birth weights, for example, for babies, may actually have quite some dependence on proper nutrition and exercise in a way that we're not able to pick up right now with the types of surveys that are given to pregnant women. So we're looking at simple studies at first, small n, as sort of a pilot of this to see also compliance issues, etc. And this is with a predominantly lower SES group, and so there's a lot of investment in providing support for them coming into the clinic, which will have strong health outcomes for them in terms of just contact with the doctor as well. But we're particularly interested in looking at the ways in which their use of physical activity and their eating habits affect their subsequent risk of gestational diabetes, or excuse me, of type 2 diabetes following completion of their pregnancy. And secondly, the degree to which it impacts the birth weight of the baby.
I see. So is the mobile tool available now for research?
It is, yeah. We have a variety of collaborators, and we're always interested in talking about additional possibilities. But it's a very stable, reliable tool, and it's been deployed many times now. So I'd be glad to give you more information about it.